Hello, Peoria Heights. We're back with another episode of Tower Talk. We're here in the morning this time. Got our cups of coffee. Our guest today is Peoria Heights Fire Chief Greg Walters. He's been in charge of the village's volunteer firefighting and rescue squad since 2012. Chief, welcome.
Well, thank you very much for having me here.
Appreciate you being here. So, all over the news this week, you really can't escape it. We want to talk about the Heights' readiness to deal with the coronavirus pandemic locally, should it ultimately hit here. So what reassurances can you provide Heights residents that your department is ready to deal with this should it be called upon?
Well, all my firefighters and EMS providers have been thoroughly briefed on this outbreak and very familiar with the signs and symptoms of this virus. We've enacted special emergency response protocols, a little different than normal for this, to allow us to treat those that become infected and to best protect the public and our first responders as well. That's a primary concern of mine.
Right.
The first responders are in their first hand, and they have to be protected so they can continue to do their job.
Absolutely, sure, absolutely. So so you're on an airplane, and when the masks, you put it on yourself first because you got to take care of yourself first, so you can take care of somebody else, right?
Along those guidelines, there's specific personal protective equipment, which we refer to as PPE, that we've always had. We're required to.
Yeah.
We didn't have large quantities.
Yeah.
Well, when this started to surface, one thing we did do is contact our vendors, and we have got adequate supplies, more than adequate supplies, to take care of our first responders who are going to go in and take care of our public.
So talk a little bit about that special equipment. Describe what it is exactly.
Okay, it's what's recommended.
The protocols that you generally follow. Yeah.
What's recommended? Well, the protocols normally, the protocols normally when you respond to somebody who has like flu-like symptoms. They recommend a surgical mask or another mask that they refer to as N95. It's approved through OSHA.
Right.
N95 masks are pretty expensive. So most departments will go down to the surgical mask. And what this protects you from is any particulate. Somebody coughs, any liquid, it doesn't get on you or in you, so to speak. The N95 mask is more, it does the same, but it filters everything else out. And that's what's pretty much identified as the mask that we need.
Right.
So we were able to get ahead of the game, and we've got a stockpile. We don't have them here, but we have them in the vicinity. It just takes a phone call, and within 15 minutes we'll get them.
Okay.
And the good thing about it is I don't pay for them if I don't use them.
Right.
So it's good. Another issue, particularly since we're dealing with somebody who's coughing, body fluids are coming out of these people. We need to protect the clothing they're wearing as well. So we have Tyvek suits. They're special. They used to call them hazmat suits. Painters use them. We've got boxes of those, which we have readily available to our firefighters. And also there is a shield that you put over your face that comes down to protect splatter so it doesn't get in your eyes.
Right.
So we have that all, and we have...
So they don't come in looking like astronauts necessarily, but
no.
they do. It's not like a normal...
Yeah, it's a little bit more than usual with this particular case. Yeah. And also they have we wear orange surgical gloves, protects our hands. In most cases we'll respond, sometimes we'll have a mask, we always have gloves.
Okay.
In this particular case, due to the severity of this, we've upgraded it now, and it's protocol that whenever they respond to it, all members of that unit, when they get to the scene, they don't wear it while they're driving.
Right.
But when they get to the scene, they will put this equipment on. So it could look like something out of Ghostbusters or something coming in there, but that's the purpose, is to protect the first responder. One thing in addition to this is if we do have hands-on with the patient, and the patient is going to leave the house and go to the ambulance, we will put a surgical mask or an N95 mask on their face before they leave.
Okay.
That prevents any coughing or anything from spewing out.
Right.
It might not be the right choice of words, but it keeps it contained there.
No, I understand.
And that's not the norm.
So has your staff received additional training to deal with a contagion like this one, or was it part of the normal training regimen?
Well, it is all part of the normal training. Pandemic event training is an annual thing we do through our EMS training, which is always the fourth Wednesday of the month. And that's always part of it, but it's very generic, it's very general. Because of the specifics of this particular virus, we got more specific with our training. As a matter of fact, we had, and I guess the word you want to call mandatory training last night. All members of the fire department were present, and we had written myself and another individual, we wrote a standard operating procedure. We have one for pandemic events. We did not have one specific for COVID-19. We wrote one specific for COVID-19 simply because there's different dispatch protocols from Emergency Communications Center. So we added that to it, and we trained them on what to listen for, what questions. There's additional questions that you ask your patient, and one thing that's unique about this particular deal is, and the Department of Public Health requires, or not requires this, they suggest this. Usually when we come into somebody's house, we go to the patient and we talk to them. Right now it's referred to as from the door assessment. We try to stay at least 6 foot away from the patient or from the caretaker that's with that patient, because they're approximating the 6 foot distance is what a sneeze would travel.
Right.
So to keep you protected, we can still communicate and we can get the information and we ask the questions of the patient.
Sure.
And if the questions start to line up that they're possibly COVID-19, then we act accordingly.
Okay.
In most incidents when we respond, anybody who responds on the fire engine or our rescue squad will all go into the house.
Right.
One guy goes in first and then everybody else brings the equipment. Now it's limited access. And I understand that entirely. It's to prevent the spread of this. The less amount of people inside, the better. So if we are first on the scene, the person with the highest medical authority, whether they're probably an EMT, because what we run with is first responders, EMR, which is emergency medical responder, and then EMTs. The EMT is the higher medical license. So if we show up with first responders and EMTs, the EMT is going to go in by himself, and he's him or herself, and they're going to ask questions as they go in, and again, assess from the door.
Sure.
And then make that determination whether this person is COVID-19 or not, and it's very generic, flu-like symptoms.
Yeah, I was going to say, what kind of questions are you asking folks?
Yeah, I mean, well, they're more specific on there. Have there's a lot of travel questions. Have you been in an area where this infection is known? Have you been outside the country and stuff of this nature? How long have you had these symptoms? Because right now they're saying they say a 2-week incubation period of time. Anywhere from the 2nd day to the 10th day is when it shows up. So how long have you had this? And this whole time they're writing it down. And if all these questions align, then they will react accordingly. They will allow let the dispatcher know in a proper manner so that information can be sent to the ambulances responding, so they understand what they're up against, because they're going to have to be dressed as well.
Right.
Now keep in mind, when they show up, they are a higher medical authority. They will be taking over the incident as soon as they get there.
AMT here.
AMT, yes.
Right.
They will be taking over the scene as far as patient care, so on and so forth. Our guys will back away. The individual from our department that's in there working with the patient stays with them until they get them loaded. Then he takes all his protective gear, his PPE, and they put it in what we call a red bag.
Yeah.
This bag is marked specifically for etiological agents and stuff of that nature. It doesn't go in the garbage. It is sent out to a waste disposal area where it's destroyed. So anything and if he feels that he has been contaminated, then we have protocol involved where he would have to be quarantined.
Okay. So do you get quite a few 911 calls this time of year for flu-like symptoms? I mean, have you had a lot? This is
we have not had a lot this year, thank goodness.
Yeah.
Now, in heightened awareness now, we have not responded to any, Peoria Heights has not responded to any what we would refer to as a COVID-19 call at all.
Yeah, so far as we know, there have been no.
Well, as of 7:15 this morning, the information I got through my sources is there's still no confirmed cases in Peoria County.
That's my understanding as well. Yeah.
Right.
Some people have been tested.
There's been a lot of rumors out there.
Yeah.
I mean, whether it's on Facebook or social media, so and so has it. I hear in good favor that so and so got it. No. That's right now, as far as I'm concerned, from the people I deal with, there's zero in this area. Which we have a profile for this. We have step 1 or level 1, level 2, and level 3. Level 1 is where we're at. That means we're watching.
Yeah.
Okay.
The least serious.
Right. If it goes up to a level 2, that means there has been some confirmed cases in town. That's when we will enact what we're talking about, where just one guy goes in and does that. We start doing it at level 1 just to get in the practice of it. Okay. Level 2, there are known cases here, so the possibility of spread exists. So we fully go in, and level 3 is when there's a lot of them here,
Right.
and the potential spread is going rapidly, and the hospitals and the resources there are becoming thin. So we would probably do nothing inside the building simply because it's going to take somebody of higher medical authority to make that decision, because the decision has to be made: are you going to go to the hospital,
Right.
or are you going to stay here? And that decision will be made by a paramedic because of their increased training.
Okay.
And that's kind of what we're pushing towards. I mean, unless they are really struggling for breathing and so on and so forth, stay at home.
Okay.
Okay.
So what are local medical professionals telling you? What are you hearing from them? What tips and advice are they giving you?
For the public?
Yeah.
Well,
And
for the
what
public,
are they saying that's different about this than any previous?
I don't know if they're saying there's anything different about it. We're handling like a normal pandemic event, if there's such thing as a normal pandemic.
Yeah.
But like a flu outbreak or something like that. If you practice normal hygiene, washing your hands.
Yeah.
Each individual has to reduce the spread of this, and by doing that, you wash your hands, cover your mouth if you've got a cough or a sneeze. Just because you're coughing and sneezing doesn't mean that you've got COVID-19.
Yeah, right.
Okay? And that's a misconception.
Yeah.
Okay. Use a new phrase that's all over the media now. It's called social distancing. You can practice that if you so desire, and that's keeping about 6 foot away from somebody else.
Yeah.
Particularly if somebody's sneezing or coughing, just back away from them.
Yeah.
All right. And probably one of the most important things is if you feel you've got it, don't spread it. Stay home. Call in sick. We're all hard-headed on that. Oh, I got snuff. I'm sneezing and stuff like that. I can still go to work. No. If it's a sign or symptom of this, it might be nothing more than the flu, or you've got a cold. Do yourself a favor and do your workmates a favor and stay home.
Right.
Stay home. But if you feel you need it, contact your doctor.
I suppose there's a responsibility there too for local employers, local places where people gather. That if you have an employee that comes in sick, that it's best that you send that employee.
No, I agree. No, I agree that 100%.
Are there any additional precautions that again, places where people gather, in any number, churches, etc., local restaurants, bars, whatever, that they can do, extra precautions they can take? We've talked a lot about what the individual can do,
Well, that's honestly up to the individual organization.
Yeah.
You're seeing some major organizations that are shutting down because of COVID-19. Yeah. That is their decision, and I'm not in any position to say that you did wrong or right.
Yeah.
When you look at it in the big picture, it's basically the right thing. You're preventing all these people. So you're preventing people from showing up there. Therefore, that's going to prevent the spread if anybody's there.
Yeah.
Okay. As far as places of worship and organizations such as that, again, it's an individual thing.
Sure.
If this progresses, if this gets worse, I'm sure the Department of Public Health will come out and make recommendations.
Okay.
Local fire departments will not. We're not empowered to do so. Plus, we don't deal at from that end. We're on a personal basis.
Okay.
We deal with the individual, the individual who's got these symptoms.
Sure.
And one thing that I, as the fire chief, have to do, I have major concern about the health of my firefighters. And anytime they respond to a call like that, or if they would, I know it would cause me quite a bit of anxiety.
Sure, no, I understand.
And I would have to make sure, and my other chief officers feel the same way. When they get back, we will thoroughly talk to them, find out did you get anything on you?
Yeah.
What was the symptoms? And we have built in place where they can be sequestered if we need to, quarantine them for however long.
Okay.
The recommendation now is if you feel that you've been contaminated, it's a minimum 2-week quarantine.
Right.
And that's whether you do it at home, you do it at work, whatever is set up for you. I would not want anybody, if it was one of my firemen that came back, my fire truck could be cleaned.
Yeah.
We can disinfect that. We use Cavicide. We can do that.
Yeah.
I don't know. I'd have to find out, do I want this person to go home to infect his family, so on and so forth. So we'd probably leave him here for 2 weeks. And we've got that already built into it.
Right. How about especially high-risk spots, such as nursing homes?
Nursing homes, which we have 2 here.
Yeah. Are you aware of any extra measures that they're taking?
As a matter of fact, I've been in communication with them since this really surfaced. Both the nursing homes have practiced a limited access policy for visitors. Basically, they come in, they have to sign in, and in one case, they actually have their temperature taken. But they limit how many people can be in there at that time, which is a good move. And I think they have learned from that tragedy in Seattle.
Right, absolutely.
Where that,
sort of the epicenter.
The epicenter of this whole thing, where they lost, I think, 9 members of that. And honestly, the nursing home and people in that age are the targets. They have weakened health to begin with. They're aged. I fall in that age group, because they're saying 59 is the mean.
That's me.
Yeah. I'm 64, so I'm there. But fortunately, I think I'm relatively healthy. But that's what they're focusing on, is that age group. And if they have other issues, other medical issues, autoimmune disease, anything of that nature which weakens their immune system, they are susceptible to this.
Okay. So the coronavirus has taken a toll already, if not in the number of Americans infected, certainly in the fear that they might be. And so, state basketball tournaments in Peoria have been canceled. NCAA's March Madness, Bradley's chances to play there, too bad. Schools being closed in some instances around the area. St. Patrick's Day festivities are being postponed or scaled back. There has even been a run on certain products in certain states.
Oh, is that not the truth?
Seeing the video.
Which really has no correlation to this.
No, right. So you might say in some ways a bit of a panic has settled in some quarters. So I just wanted to ask you if you think that's all warranted, or are we just in a situation where we're better safe than sorry?
Well, that's a good question. It's hard for me to say. I do believe panic has set in. Anytime a new virus, presents itself, it's definitely an object of concern, but not of panic. We need to sit back, take a look at what's going on here, and act accordingly. I don't think going out and buying all the toilet paper was a way to do this.
Right.
But there's a certain amount of panic, and I think some of it is led by some of the information or partial information they get off either the internet or from the local news media or national news media, kind of sensationalize it. The public needs to know about this. But the more you talk about it, the worse people get. As it stands right now,
it takes on a life of its own.
Oh yeah, it does. It takes on a life of its own. But you listen to the news media reports. The thing to listen to is, are there any reported cases in your local area where the possibility of spread could be? And as it stands right now, that answer is no in the Peoria County area. There have been those that have been tested for it because they presented the signs. But like I told you earlier, a lot of the signs are very similar to flu. Potential, I don't know.
Nobody can predict.
Nobody can predict that.
Yeah.
But again, and what I'm being told by healthcare professionals and members of my department, myself included, have been in constant contact with them on what we can do, what we should do, and basically they're saying practice proper hygiene.
Sure.
Wash your hands. If you've touched something, don't put it to your mouth.
Right.
Don't let you become an opportunity for that virus to enter you.
Exercise common sense.
6 foot away if you feel you need to. And I have seen some things. I'm a handshaker.
Yeah.
I just that's how I was raised.
Yeah.
Okay. And I'm seeing him change to the elbow bump or the fist bump and stuff like that. I get it.
Yeah.
If that's what you want to do, then by all means stick to that, because it prevents the contact. Or if you do a handshake, wash your hands. It's not going to be rude.
Right.
Whether you wash your hands or you use the Perel cleaner or whatever.
Yeah.
So
good. Well, this has been very, very educational, and whatever the case here, I think our emergency responders are as ready as they can be for whatever comes, and I think people should feel some confidence of that. Chief, thank you.
Thank
for
you.
doing this with us. This wraps up another episode of Tower Talk. Be careful out there, and as always, remember to tune in to Tower Talk for the latest on what's happening in your Peoria Heights.